Hello, I'm Dr. Richard Okoye. What I'm about to show you right now is the wonders of the age that are actually now happening in the area of the anal region. Because it's something that all of us, we call it private region, private organ, private, because it is only you that is seeing it, or someone, you don't want any other person. But I have a good news to share with you right now with respect to pile, which is also a good news to anyone you know that has a problem that has to do with pile, otherwise called hemorrhoid, or the one they call rectal prolapse, which we most times interchangeably use pile as also referring to that, but they're not same, because in pile the person will just go to toilet and blood everywhere, and in most cases it doesn't pain. But in the case of rectal prolapse, what happens is that this person will go to toilet, after defecation the entire anus or the mucosa of the anus will come out, so he has to use his hand to push it back. So we also have a problem that has to do with pus discharging around the anus. These are some of the things people pass through, they don't tell. But I will be in position to tell you a good news you will also share with them. Right now we are battling with a lot of infectious diseases of Ebola, coronavirus and all that. So we need to be in position to get this good news, share it with everyone you know. That today the cost of treatment of hemorrhoid or pile have completely changed. This time around, pile, anorectal, fistula have all gotten 5 minutes, 10 minutes, maximum of 30 minutes solution by reason of laser. At this very juncture, I want to show you something quite amazing. I mean, amazing in terms of technological advancement in the area of taking care of the pains of people and discomfort and the frustration secondary to pile and order. What you are seeing here is the anus. Don't worry about, most times we pretend as if, no. It's not a function of calling it private organ. We are talking about solution to what has messed the life of so many people up. This is what is called hemorrhoid or pile. If you have a look at this, you can see this is the mucosa of the anus that just bulge out. As a matter of fact, all these things you are seeing here, an engorgement of the blood. It's a blood that's just pushed up here. If you touch this a little, or something that has to do with maybe a hard stool, during defecation, if somebody had constipation, you find out that once the hard stool touches this, you see blood everywhere. All right, and that's exactly what you see. Most people in the area that have issue of pile, they play around always with this kind of a thing. And some also, the entire mucosa will come out, so they have to push it. You call that particular one rectal prolapse. It's not the same as pile, because this particular one, I will show you the solution on it, while the other one will require a laparoscopic intervention to anchor it on what is called sacral promontory, but it's a different ballgame. Have a look at it right now. Did you know that this very problem before this time has to be, you have to come to the hospital, do the surgery, you have to cut it, and then it heals gradually, you have to sit on it. But today you can do what is called laser procedure. This is the same anus within 10 minutes with a laser that is painless. There is no bleeding, no issue of coming to stay in the hospital. Same day, if this very same fellow that had this, the same day this is done, within 10 minutes, 15, depending on the degree, to 30 minutes, and this entire thing could be done, and this very fellow can go back again and start maintaining good anal hygiene. Isn't it amazing? Share this with all you know, that by so doing we can help our loved ones, our friends, maintain a good anal hygiene without having to go through surgery to have their life back again. Share with all you know. I remain your friend, Dr. Richard Okoye. See you again.